Ms. Lewis, I wonder if you can just start, please, by just telling us a little bit about your relevant background to this tribunal and the organisation that you're currently involved with and the work that it does, please.
Yes, so I'm coming from the Angelou Centre. I'm Deputy Director and Manager of the Violence Against Women and Girls Services there. We're a Black and Minoritized led by and for organisation who's developed services over the last 30 years in consultation with Black and minoritized women and children. We have 3 pillars of our work, which is looking at socio-economic inclusion, well-being, as well as violence against women and girls. In terms of the violence against women and girls services, we deliver a range of services: advocacy, refuge support, children and young people support, as well as recovery training. And we also provide a number of specialist services for migrant women and girls, including dedicated refuge and accommodation spaces for women without recourse to public funds, who, as you know, are currently excluded from mainstream accommodation support and safety and protection. We've also been involved in developing a lot of policy work in relation to national campaigns around violence against women and girls, particularly around migrant women, no recourse to public funds. And we've just recently completed a commission for the Domestic Abuse Commissioner of England and Wales around the issues that many migrant women and women without recourse to public funds face. And also the Angelou Centre has participated in civil sector representation at the 2019 CEDAW Convention, and also we were part of a CEDAW shadow report submission, which was brought together by a coalition of women's services and was overseen by the Women's Resource Centre.
Thank you, Ms. Lewis. And can you just say whether today you're speaking in personal capacity or in some other capacity?
I'm speaking in an organisational capacity on behalf of the Angelou Centre.
Very much. And you've prepared a witness statement, and for the judges that is at document 114 and the evidence supporting that is 117. Ms. Lewis, my first question is rather general, but it's obviously in respect of your particular expertise and experience, and it's this really, for you to comment on any areas in which you can see that the UK has failed to ensure compliance with its obligations to ensure full enjoyment by women of their human rights and fundamental freedoms without discrimination.
As the Angelou Centre is based in the northeast of England, I'll start with looking at some regional inequalities which are often overlooked. Unfortunately, we know public sector equality duties are not enough to ensure people's rights and human rights. There's often a lack of impact equality assessments, and the accountability measures are very inconsistent regionally. There's often a lack of independent specialist community-based services in certain regions, and it's disproportionate in certain regions. And there's often a co-option of specialist work and some gender neutral services that are dominating certain areas of the country, which really presents an issue in terms of upholding women's rights. There's also the fact that many services distributed around different regions of the country are already discriminating against and refusing to work with certain groups of women, namely, I would say, migrant women and women without recourse to public funds. And unfortunately, that has no legal standing. It is just a form of discrimination. Often in the regions, we'd refer to something called a static white workforce, because in areas like the North East, we'll have less than 5% Black and minoritized workers within statutory agencies, for example, but within some inner city areas, we'll have over 40% Black and minoritized children that are accessing schools. So you can see that there's an inherent issue around competence and support and inbuilt infrastructural support for Black and minoritized communities. We know that often maternal poverty is in line with health and socio-economic inequalities. So we really have to think about children being a really good indicator of the inequalities that many communities will face. and particularly women. And there's also thinking, you know, more broadly, we've got multiple socio-economic inequalities that Black and minoritized women face, as very well researched by Forces Society, Women's Budgetary Group, etc., particularly around employability, which has stagnated over the last 30 years for Black and minoritized women, and who still have the worst socio-economic outcomes and lack of access to the workforce. There's also a lack of funding for those community-based services that provide that very critical kind of route towards training and employability for Black minoritized women. So, for example, at the Angelus Centre, 95% of the women who walk through the door when they first come to the Angelus Centre are not in training or employment or any sort of education. I just wanted to mention how COVID has really compounded existing inequalities. In the Northeast, you'll know that it's really hit women the hardest. Many women have lost their jobs. They've often been in 0 hours contracts. They've often been in part-time, low-paying jobs in, for example, the service and hospitality industry. And that's had a really big impact on many women across the country, but regionally, but also migrant women. So women who can't access recourse to public funds, but are able to work, for example. So you can imagine the impact of, you know, the current precarious socioeconomic issues that are going on for many migrant women who are having to work. If they lose that, they're very, very vulnerable to exploitation and further forms of violence. And also for specialist services, again, I think that COVID really shone a light on the inequalities that specialist services, who are often the only services who are supporting Black and minoritized women and migrant women, how that really impacted on them. So, for example, nationally, members of IMCAN are a second-tier organisation, of which Angelus Centre is a member. But IMCAN showed that the majority of organisations put together, you know, welfare banks, tech banks, put together hygiene banks to support women who were not getting any sort of support and were literally facing street homelessness as well as food scarcity and other issues. And local authorities, despite having specific COVID funding, Black minoritized women's services did not benefit from that. The majority did not benefit. So there's a lot of structural inequalities, obviously at a national level, but really become apparent in that localized and regional level. Yeah, so I'll leave it there. Thank you.
Thank you, Ms. Lewis. That's a very thorough and detailed answer, and there is lots of information in that. Some of that has touched on some of the questions I was going to ask. But I think my next question I'll put to you is this, and it's about the ways in which CEDAW can address the inequalities that you've spoken about, in particular the multiple socio-economic inequalities. So the question is really, how can those inequalities be addressed by CEDAW, and in what ways?
I think the beauty of CEDAW is that it's an integrated and holistic way of approaching women's rights through a truly intersectional lens. And the articles very much interconnect and overlap and provide more of a holistic understanding of the many issues and barriers that women will face, which is incredibly important. It covers all areas of women's lives, but particularly is able to better articulate and support the issues that the multiple and compounded issues that Black and minoritized women face. It really does support issues around access to justice that many of our organisations in the Black and minoritized women's sector and specialist sector face. And it speaks to women who are often excluded from mainstream statutory support. As we know, the Domestic Abuse Act, for example, that specifically excludes migrant women and women without recourse to public funds. We have no safety net for those women. So CEDAW really provides us with that holistic safety net for women that is very well informed in terms of looking at multiple barriers. We also know that lack of access to safety and protection that many women face in relation to housing, healthcare, food scarcity, etc. It makes sure that those issues are not seen as single strand issues. And it provides us a lens to look through those composite kind of national and regionalised and localised issues and that picture that women face in terms of socio-economic inequalities, for example. And I think Nick Newland just discussed a lot around the issues that rural women face, and this particularly impacts on Black and minoritised women. And I'll give you an example of, for example, Durham. Durham is quite a large area in the northeast of England. At the minute, there are no specialist organisations that serve that area. The Andrew Centre, for example, does a lot of support of women in the Durham area, but women are very much dispersed around very tiny villages and rural areas in Durham without any support. And this leaves voluntary Black and minorities-led organisations to provide that infrastructure of safety, support, referral pathways, even socio-economic and welfare support as well, which women cannot access. But for example, in Durham, there's no specific funding that's put aside for Black minorised women. So you can see that compounded level of discrimination that often goes on for women in a rural context.
Thank you. My next question then is about gender-based violence, Ms. Lewis. So do you consider that there is sufficient or adequate intersectional approach to gender-based violence and to women's right to equality and non-discrimination?
I think I'll just preempt this by saying there needs to be an understanding of intersectionality outside of singular kind of identities and presumed or imposed identities. And actually, the intersectionality really brings in a fuller understanding of structural inequality. And this is often very poorly embedded, as I've said, within current legislation that directly impacts on women and policy. Yeah, at local or regional level. And outside of non-specialist services, it's very rarely accounted for. And services, they fail to often be mainstream services, gender neutral services, for example, commissioned services who receive funding. They often fail to be appropriate or competent in their ability to work with Black and minoritised women. And already we're seeing how commissioned violence against women and girls services, as I previously mentioned, are breaching women's rights, and they're often choosing whether to work with certain groups of women. And again, I'll give you an example to illustrate this. We've had to present a lot of challenges. Even though we provide refuge support, we are always full and always have a waiting list, because women who do have rights and should be able to have access to refuge accommodation are being turned down on premises such as, we already have one Pakistani woman in this refuge, we can't take another. So it's this kind of discrimination that is almost normalised, and it's becoming more and more normalised in civil society, but particularly in organisations that should be supporting particularly vulnerable women. I also think this intersectional lens really helps us to ensure that services and the policy, is informed by a fuller understanding of violence against women and girls. We know this has been a constant recommendation of the CEDAW committee around understanding interlocking forms of violence. At present, as we know with the Domestic Abuse Act and the splitting of a violence against women and girls strategy, because so much is excluded from the Domestic Abuse Act, that we're setting up a two-tier system around levels of support. Because obviously the Domestic Abuse Act has certain levels of privileged kind of legislation and enforcement and accountability, but the violence against women and girls strategy, although we're still waiting to see what happens with it, isn't going to be providing any kind of authoritative teeth, and we're not sure what the accountability framework. And if we're looking at a strategy that is pretty much going to be accommodating all Black and minoritised women's issues because they're excluded from the Domestic Abuse Act, we can see how that split between different elements or issues that women face, if we think about violence against women and girls as an example, has a really direct impact on Black and minoritised women who are already facing multiple forms of exclusion. And we were also going back to that understanding of different levels of support for women. We now have a system that is kind of split into kind of mainstream support, another tier for Black and minoritised women that is inadequate, and then a further inadequate tier for migrant and women without recourse to public funds. So there's a real challenge to Black and minoritised women being able to gain access, equitable access that they should have, and their rights should be protected around access to justice, safety, protection when they face gender-based violence. And this is the inherent importance of us continuing to have funding for specialist services and the absolute necessity of specialist services, because we're often taking on that challenge to mainstream generic statutory services on behalf of so many Black and minoritized women that are discriminated against.
Thank you for that. Another very thorough answer. So I'm just minded, Ms. Lewis, just to ask you one more question, and you might be able to deal with it relatively shortly because you have touched on it already, and it's really about CEDAW and grassroots organisations. You've mentioned training already and funding. It may be that there's nothing else really that you can say about how CEDAW might benefit the grassroots organisations as opposed to statutory organisations. Is there anything more you wanted to say about that?
Yes, because I'd like to bring in an understanding of how useful CEDAW is and how it's used within grassroots organisations, and how we are networking that support to further support Black and minoritized women who are excluded. As I've said, with few safeguards left for Black and minoritized women because of the DA Act and, for example, the Sewell report, Brexit, and this focus on gender neutrality in commission services. So CEDAW provides us, as I've said, with that intersectional framework, deals with those imposed barriers and that discrimination, but it also informs the way that we work with, consult with, and support Black and minoritized women, because what's very key about specialist services is we make sure that women's rights is at the heart of everything we do. And that includes ensuring that Black and minoritized women who access our services also understand and know their rights. And CEDAW is a particularly effective tool in doing this. So we provide, when we're doing our mainstream training, for example, we do human rights-based training and we integrate that with ESOL, for example, and we bring up an understanding around CEDAW and how it works. And we do a lot of work with young women as well around understanding and knowing their rights and also how CEDAW works. It's also enabled us very, very importantly, and I'll say this particularly in the Northeast where we're based, and particularly across the Northumberland area, we've worked very successfully with local commissioned services, with the police, with statutory agencies, for them to better understand the rights of women and to start to integrate that into their practice and the way that they respond to women's needs, and to have that holistic and fuller understanding about how we work with women through that CEDAW and intersectional framework, and how we make sure that we're able, because this has a direct impact, should I say, in terms of making sure that there's no repeat victimization, that we really think about intervention at an early stage, and that we're able to provide the full extent of the recovery support that is needed as well. So there's definitely that ripple effect that goes on by us being so well informed and situated within and in use of kind of CEDAW and all that it does, because it raises that localized level of consciousness and that human rights awareness, and it really is that tool to challenge towards change. And we know that we're not the only Black and minoritized organisation who's successfully using this within their localized and regional context.
Thank you very much.